Welcome to Kids Doc Talk. On today's show, we discuss treating kids during the pandemic and updates in COVID with our special guest, Dr. Saya, today on Kids Doc Talk.
Welcome to Kids Doc Talk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Hi everyone, Dr. Jennie here. Our guest today is Dr. Saya from MD Kids Pediatrics in Dallas, Texas. MD Kids is part of MD Medical Group, a partner of Pediatric Associates. Dr. Saya is a board-certified pediatrician originally from Los Angeles. She graduated medical school from Georgetown University and completed her residency at Nicholas Children's, formerly Miami Children's Hospital. Prior to working at MD Kids, she worked in both the Skylink and Causeway offices at Pediatric Associates. In her spare time, she enjoys travel and trying new foods. Welcome, Dr. Saya. Thank you so much for being here today.
Thank you so much for inviting me on the podcast. I'm very excited to join from Texas.
Let's jump right in. Obviously, everyone's very, very concerned about COVID. We're seeing it a lot, but let's talk a little bit about how it affects kids. Is it common in kids? And the kids that you are seeing with COVID, what are they looking like? What are some things that we should be looking for in our children to kind of be wary of or to be aware of?
So kids can definitely get infected with COVID just as much as adults. However, their presentation can be much more mild and even asymptomatic. So in children, they do present with symptoms similar to the common cold, such as fever, chills, runny nose, congestion. Loss of taste and smell can be very specific to COVID, but a lot of the other symptoms can mimic other viruses like the flu, vomiting, diarrhea, and so on.
All right, so it sounds like it can really be a variety of things, but I'm sort of reassured by the fact that it doesn't seem that they get as sick or that their symptoms are as severe as what we typically expect with adults or older adults. When kids do get COVID, what treatments are available for them?
So we generally advise parents to give them supportive care because their symptoms tend to be more mild or even asymptomatic. So we do instruct them to make sure that they are hydrating well. They can definitely use over-the-counter cough and cold medicines. However, if the child does have any complex medical problems, especially in kids with asthma, for example, those treatment managements may change depending on their how severe their exacerbations are.
You know, you see a lot of things on right in the media about potential treatments that are available, right? There's antibiotics and things like that. Is there any role, as far as what we know so far, about using those types of treatments, like antibiotics, azithromycin, that kind of thing, for children who have been diagnosed with COVID?
So in general, we do not recommend antibiotics as a treatment for COVID, unless the child has a complication from the symptoms of COVID. So if you have a runny nose, that can easily lead to an ear infection in younger kids or even possibly pneumonia. And those may require antibiotic treatment. But in general, for the more common symptoms of COVID, they mimic the cold. So we do not recommend antibiotics.
Got it. Okay, so basically just like any other virus, right? We want to throw something at it, but likely just needs time, right? And
right. We do get a lot of parents that when they hear COVID and it's an immediate fear response of fear, which is appropriate. There's a major pandemic going on, but we do forget that there are other viruses that are in this world, and the treatment can be very similar.
Sure. Okay. All right. Good to know. So, talking about COVID, obviously we can't forget mentioning masks and social distancing. Is there any benefit to that in kids? Do we see transmission of COVID from kid to kid? And how beneficial is that to continue, enforcing mask wearing in our kids, which obviously can be very challenging?
Wearing masks among children are highly recommended still, even if they are asymptomatic, and especially because they're asymptomatic, because they can be carriers of the virus and can spread the virus easily among their family members. Here in Texas, we do have a large population of families that have many kids, 5 or 6 siblings. So one can be positive for COVID, another could be positive and asymptomatic. So in order to prevent the spread of COVID, we do definitely recommend wearing masks. And the CDC does say that kids under 2 don't require masks.
So, right, when you're mentioning things like large families, that makes me think about kind of that type of environment, either a family that has several children in the home or maybe like a childcare kind of environment. Are we seeing transmission from kids to kids, or are we seeing transmission from kids to adults, or is it more likely that it's going to happen the other way, where an adult is more likely to transmit it to the child?
So if there is a positive child in the family or any family member that is positive for COVID, there's definitely a chance for transmission. And what we worry about with children is that they have extended family members, especially with the holidays recently. Them visiting grandparents has been difficult because the transmission risk is there. It's high.
So something really important to remember. Obviously very challenging to continue to keep families apart, but sounds like that's unfortunately what we have to keep doing given the current high numbers. Talking about masks, and especially the fact that kids younger than 2 don't necessarily need to wear masks, I get a lot of questions from parents of kids who have special needs, right? Either kids with autism or on the spectrum or any kind of delay or sensory processing disorder where mask wearing is challenging for them. Can we just let those parents kind of skip the mask wearing, or what are some things that we can do to encourage them regarding the importance of continuing to getting their kids to wear the mask?
That's a very good question. We do definitely have children who have a more tough time keeping their masks on for whatever reason. And I did recently actually have patients with that exact same question. There are other options such as face shields. We do encourage mask wearing still with the face shields, but if they happen to slip off or they tear it off, the face shield is still there as a protection.
So it sounds like needing to have a few sort of mechanisms, protective mechanisms.
Right. And if you look online, there's so many different styles.
Right.
So it's whatever the kid will be comfortable with.
For sure. Yeah, it can be challenging, I think, even for neurotypical kids to have it on all day long. Even for adults, right, to have it on for a long day, I think is challenging. But I think it's important to continue to reinforce that. And even with kids who don't tolerate it for long periods of time, just continue practicing, right? Having them wear it for short periods of time, positive reinforcement, positive rewards, right? Whatever's going to work for them to have it on.
Definitely encourage hand hygiene, washing hands,
right.
Talk in a more positive manner with what we have to comply with.
Right. Okay. So talk a little bit about what we see in kids with COVID, what we can do about kids when they have COVID, what we can do to prevent COVID. But let's say, right, you have a child diagnosed with COVID, hopefully had a mild course, hopefully recovered. What are some long-term consequences of COVID that we should be aware of?
With milder cases in children, they do tend to recover very well. The typical pattern of the virus is very similar to other common viruses. Usually the first 3-4 days can be the worst, and they typically get better beyond those first 3-4 days. There have been very rare complications, and I'm sure many of you guys have heard of the term MISC being thrown around. It does mean multi-inflammatory syndrome, multisystem inflammatory syndrome in children. So in short, we call it MISC. So what MISC is a complication that can happen actually for about 4 to 6 weeks out from the initial COVID infection. And children can present with fevers again. They can look fatigued, they can look tired, they can have vomiting, nausea, a rash, they can have shortness of breath, and that can manifest as an even more severe reaction with inflammation of your organs or body parts. So that's definitely something we make sure we look out for, especially with kids presenting back to our office after a COVID infection.
Okay. So sounds like it doesn't necessarily have to happen at the same time. It happens like much, much later. So really important to kind of to kind of be aware of. Yeah, we had a few cases here in Florida. I'm sure you guys had some in Texas as well.
Yes.
They do recover, but certainly it is a little bit more prolonged course and requires hospitalization in many cases. So that sounds right. That's kind of like one end of the spectrum where, right, unlikely, right, consequence, but definitely a severe one. What about kids who really, had a mild course or maybe just had some fever, kind of respiratory symptoms, cough, shortness of breath, recovered? We're not worried about MIS-C, but we're dealing with an athlete. What are some things that we need to do or know about letting these kids return to sports? Any kind of screening that's recommended, or once they're recovered, they're kind of good to go?
So screening for sports has been a hot topic as well, especially when school started back up. We do have a protocol in place, and the protocol is based on how severe the child's symptoms were during the COVID infection. Now, if the child was asymptomatic and positive and recovered very well and quickly, we usually clear without any issues. However, if it was moderate or severe, and then depending also on the age, we may get specialists involved, such as cardiology, to make sure that everything checks out for them to be able to participate in sports.
Okay. All right. So good to know, kind of keep in mind for our athletes to make sure to follow up with their pediatrician after COVID infection.
Right. And definitely let the pediatrician know if you do have a history of the infection so they're aware.
Mm-hmm. For sure. Okay. Important stuff. I know that I think the AAP and the cardiology wing of the AP is planning on coming out with formal recommendations soon, but because it's so new, right, we don't really have like enough data to see where these kids have ended up, what consequences occur, cardiac or otherwise. So like everything else with COVID, we kind of have to wait and see, right?
Right. Unfortunately, this whole thing is very new to us. And so a lot of this is a learning process.
Okay, so speaking of things that are new, let's move on to one of my favorite topics, which is vaccines.
Yes.
They're very exciting, right, that we do have some vaccines emerging for COVID. Talk to us a little bit about what vaccines exist right now, right? What ages are they available and how effective are they in preventing COVID?
So I have to say it's pretty remarkable that we were able to come out with a few vaccines, 2 of them that I'm sure many of you have heard of by now. One is by Pfizer and the other by Moderna. Now, those are both 2-dose vaccines. Pfizer has been approved to be given to kids as young as 16 years and older, and Moderna 18 years and older. So in our clinic currently, we are not offering the COVID vaccine, but they are approved for those ages. And there are ongoing studies. They are trying to enroll younger aged kids. Right now, they are enrolling, the youngest, I believe, is 12 years old, but they're trying to do some trials for children so that we can get these vaccines out to the younger kiddos.
That's excellent. That makes me kind of really excited because I know that there's families that are looking forward to getting their kids vaccinated and protected against COVID. The current vaccines that exist, you mentioned Moderna and Pfizer. What do we know so far about their effectiveness? How good are they at preventing either getting COVID, severe disease from COVID, or mortality or death, which is what we're always trying to avoid?
Right. So the effectiveness is pretty high, well over 90% with the second dose on board. The peak efficacy, however, doesn't kick in until about a week or 2 after your second dose. I will say that with the second dose, we have been seeing some side effects, very mild side effects that also can be seen in other common vaccines like sore arms, fevers or chills. And it tends to be with the second dose, not so much the first.
Yeah, I actually experienced it myself after my second Moderna, and I had to keep reminding myself that this is short and temporary and just a result of my immune system, and certainly is better than God forbid getting COVID. So I was thrilled and very grateful to have been vaccinated.
Right, and most people recover from those symptoms within 24 hours.
So hopefully we get some news about vaccines available for our population very soon for our kids. Obviously, you're right, you've been working and seeing patients this whole time. What's been the biggest challenge treating kids during a pandemic? I imagine there's many, but what's like one thing, if you had to pick one that's been exceptionally challenging?
It's been challenging in general because with this pandemic going on, everyone's focus is on COVID. And we do forget that there's other infections that can happen. Kids can get sick with many other things. So we do have to handle all of those cases in children that come in sick. So we have to be very alert about trying to be aware that we're still seeing common colds. We're still seeing kids that have, stomach bugs, ear infections, asthma exacerbations. So we definitely have to keep that in mind. I wouldn't say that we're seeing a lot more in volume of sick kids. I think there's just more to consider during this pandemic.
Makes sense, right? So masks and social distancing work, right? But that means that they also prevent kids from getting sick with common viruses. So I definitely understand not having as much volume, but more things to consider. And well visits, right? I think people are nervous to kind of leave their house and not coming in for well visits. So I think that's also really important to remember that. I'm sure your practice is as much as we are, is doing our very best to kind of sanitize everything, keep things safe, and it absolutely is appropriate and safe to come in for your routine well visits. Make sure we're not missing out on vaccines. I know that was a huge issue for us during physical season, that we were just missing a lot of families because they were nervous to come in.
We have it set up so that our well checks are healthy kids come through one side of our office, and we have dedicated rooms for the healthy well visits. And then we have dedicated rooms for sick visits. And those that are high risk for potential COVID infection, we do actually offer curbside visits where we have almost like a drive-through sick visit area. In our office, we do test for rapid COVID antigens, along with flu and strep and other swabs.
Wow, that's excellent. So they can just come in and stay in their car and if they're really trying to avoid exposure, that's an option for them.
Right. So that's our way. That was our solution to try and limit exposure inside the office so that those families who do bring their healthy kids for a well check feel comfortable as possible. And we've been getting a lot of positive feedback about the curbside visits. And it's something that we may even consider extending, hopefully beyond this pandemic. Hopefully when it dies down, we'll be able to offer that.
I love that. Yeah. I mean, PH is something similar where we have kind of sick and well, separated, and we have a lot of terminal clean in between each patient, and all of our clinicians are in full PPE and 100% protected and not kind of bringing germs from one room to another. So definitely sounds like both practices are doing a lot to keep patients safe and to make sure that people aren't missing out on appointments. And then we also obviously have telemedicine available. You guys do as much as we do. So definitely an option if someone really, really wants to stay home. And that's something that we're really pushing for our patients when they have confirmed COVID or have a family member with confirmed COVID, that we follow them very closely on telemedicine. Obviously, if we're getting worried about them, absolutely send them to the office. But that way, kind of trying to limit everyone else's exposure and keep the families quarantined should they need that.
Yes, so we've definitely had to get creative.
Yeah. For sure. So it sounds like you guys are doing a lot. Definitely sounds like it's a unique challenge working in this. Anything else you want us to know? Anything else that you kind of want people to know or to be aware of, given that COVID is definitely an option or a possibility in children?
I do always remind the family, kids do fairly well with COVID. I try and reassure as much as I can. I understand it's very appropriate that parents get fearful, they get nervous. I've had parents, burst out in tears. So our role as pediatricians is to provide as much reassurance as possible, remind them that COVID is still a virus and it behaves like a common virus. And it's our job to make sure that these kids are safe as possible, that we give them the appropriate guidance, and then look out for any rare complications that may happen.
Excellent. Okay. Well, thank you so much. That was extremely informative. I'm sure very, very relevant. I appreciate you spending some time with us and talking about your experience training kids during the pandemic.
Make sure you like us on on Facebook and follow us on Instagram and Twitter. Thank you for joining us on Kids Doc Talk.